I think of Mommy Makeover, I think of one of my favorite patients, Jen. She was a mother of 4, her last pregnancy was a twin pregnancy, and it took her a long time to come into my office. When I walked in the room, she looked a little nervous, and I asked her how she was feeling, and she said nervous. But at the end of the day, every day she woke up, she didn't feel comfortable in her own body. She felt like she had lost her identity with all the changes through pregnancy and childbirth, and now she was ready to get back to the Jen she remembered prior to having kids. Jen had had several friends who had mommy makeovers, but honestly it left her just a little bit more confused about what she needed because she knew that her pregnancies were different than her friends. She didn't know, did she need a tummy tuck? Did she need a breast lift? But she also felt a little deflated. Did that mean she needed an implant? She also had some fat in areas that she never had prior to pregnancy and didn't know if that could be addressed at the same time. I wanted to make her understand that she could still have her mommy identity without the souvenirs of pregnancy. She has her tiger stripes and she earned them, but there's nothing shameful about trying to get back the identity that she had prior to having those babies. So what exactly is a mommy makeover? Typically when we think about mommy makeovers, we think of 3 areas of the body: the breast, the abdomen, and then the entire rest of the body. So a mommy makeover ultimately is customized to you. Common concerns that I hear from women coming in for a mommy makeover are that their breasts are deflated. Maybe their nipples are pointing down to the ground. Maybe their breasts just got bigger during pregnancy and they used to have smaller, perkier breasts. Very commonly, we also hear about core strength. A lot of women feel like they can't do the same things with their abdomen after having surgery, just as simple as doing sit-ups in the gym. Other women also have an excess skin problem. Some have a combination of both. Every patient is unique, but I will say at the end of the day, I feel like lots of these women have guilt or sadness that they're wanting to change their body after bringing their beautiful babies into this world. And it's okay to feel that, but it's also okay to make these changes to feel like you again. I really stress to my patients that they don't have to feel guilty about making these changes. There's no amount of exercise that is going to get rid of that extra skin. And you can go to physical therapy, you could go to every Pilates class in Dallas and you still might have diastasis of your rectus muscles, which is just that separation that makes your core feel weak. So at the end of the day, sometimes you may need plastic surgery to address the concerns that you have. What I stress to my patients, no 2 mommy makeovers are the same. One mommy makeover might be a breast aug with liposuction. Your best friend, it might be a breast lift and a tummy tuck. And then your other friend may get a breast lift, augmentation, tummy tuck, and some lipo. It is all individualized to the patient's concerns.